Vascular malformations are congenital abnormalities in the blood or lymph vessels that develop before birth. Dr. Wayne Yakes of the Yakes Vascular Malformation Center is a pioneer in the treatment and cure of vascular malformations.
Vascular malformations are congenital lesions, by and large. There are some traumatic ones that can have these abnormal connections. But the main ones are ones that are congenital. And how they occur is, well, you first have a human when two gametes meet and they start dividing and making this cellular phase in the first few weeks of life. And then they go from that to start organ phase, organogenesis. And you see arms and legs, you see hands, a head. The blood vessels that work at the cellular stage do not work now at the organ stage, and that's when the body resorbs those primitive ones and replaces them with arteries, veins, capillaries, and lymphatics. And then those go through a maturation, of course, as the baby grows into 9 weeks. Well, sometimes the body makes a mistake, and there is a failure of the orderly resorption of those primitive elements. And after 4 to 6 weeks, that ability to resorb is gone. It figures its work is done. So if there's anything left that got missed, you're going to carry it till you're born. And that's why they're congenital lesions, because they're not functional at this stage of organ development, and they can cause mischief as you grow, and that's why they're present at birth.
Let's learn how Dr. Yakes diagnoses and treats these vascular malformations.
Vascular malformations are one of the most difficult things we can treat in medicine. They occur in very challenging areas, the head and neck, the brain, spinal cord, intestines, and many not become resectable. So we started developing endovascular approaches whereby we put a catheter inside the artery, a little tube, and we went in the arteries and we went to where we needed to in a hand, in the brain, in the tongue, in the chest, wherever, in the foot, in the knee. And we could super selectively access these. Then I developed the use of what's called ethanol, and that's the most potent of the sclerosing agents. And all the papers published are 90 to 100% effective with many cures. So these are pages we've turned, and that's why I use ethanol, because if I'm going to put a patient to sleep, I'm going to give them number one. I've got follow-up in patients at 27 years and nothing's back. It's stone cold normal. So this has been very effective in this regard. So we have gone from that to endovascular. Now we've also entered a new phase with different medications. It started out with being anti-cancer drugs, and they can inhibit these cells and cause some symptomatic relief. But that still doesn't cure anything. It helps with the symptoms, but the problem is still there. So what do? Relegate a patient to a pill for life with all its side effects, taking them off, then you have a rebound phenomenon? Or do we give the pill if it works? Great. But then we also should treat to get rid of it so we can take them off that pill as well. So that's our philosophy for treating these lesions. One aspect of using ethanol to the others, they're all sclerosants and they all damage the endothelial cell. But with ethanol, it is a more damaging effect because it not only damages it, it peels it off the inner lining of the blood vessel wall and denudes it. And the cell is precipitated. So it's destroyed and can't sense that decreased oxygenation. So it can't sense it. B, it's not there to send out those factors that cause recanalization and cause neovascular stimulation. Now, the goal at my center, at the Yakes Vascular Malformation Center, is always permanent ablation and total eradication. And that's a philosophy. The other philosophy is treatment with palliation. They get better, but things come back and they have symptoms again, and you get this up and down roller coaster effect. And that's with the other agents that can be employed to treat. But our goal is to permanently ablate so patients can go on with their lives, especially because these are congenital lesions. And when they come to me as a child, I want them to grow and have families and do what they wish in life, not being hampered by these things. So I prefer to do the permanents rather than the palliative treatments.
The Yakes Vascular Malformation Center is the only international practice of medicine totally dedicated to the diagnosis and treatment of vascular anomalies in all anatomical locations.